Welcome to our 2021 Maryland State of Reform Health Policy Conference. We're about to kick off our morning keynote with United States Senator Chris Van Hollen. Senator Van Hollen, thank you very much for making time to be with us. I appreciate it.
I look forward to diving into questions because there is so much going on, and I really want to, focus on issues that you want to prioritize here. But the main things we're working on are, number one, implementation of the American Rescue Plan, which, as you know, was a historic piece of legislation, lots of important elements, and we need to make sure we now get the funds to where they're needed. So we're doing oversight on that as we work on the next major initiatives. One, of course, is the American Jobs Plan, which was to modernize our infrastructure. And that's an expansive 21st century definition of infrastructure. And also the American Families Plan, which involves trying to make sure we have a workforce, an education system that can support the jobs of the 21st century, and importantly, expand access to more affordable healthcare going forward. So a lot on the plate right now, and that's not even counting many bills that have passed the House of Representatives that I strongly support, that I'd like to see us take up and find a way to pass.
It feels like we are in a place where the temperature has lowered for some, I think, obvious reasons. Is COVID still as divisive an issue in the U.S. Senate amongst some of your colleagues or in the Congress in general as it appeared to have been during 2020?
Well, I would say not as much in Congress because we now have an administration, the Biden administration, that is focused on pursuing the science and really stepped up the federal government efforts to deploy the vaccines and to make sure that they're getting to where they're needed most, including, many communities that have been disproportionately harmed by the COVID-19 pandemic. And so because we're now in the implementation phase and not so much the legislation phase when it comes to the pandemic response, the focus now is on what comes next. But the American Rescue Plan, in the end, we had to get this passed through the reconciliation route. Unfortunately, we did not have any Republican support for it, although in the Congress, although around the country, all the surveys show that this is broadly popular with Republicans, Democrats, and independents alike. But because we've now enacted that legislation, there's less controversy over what steps to take next with respect to the pandemic.
I know, obviously, you're a member of the Senate Budget Committee, and the chair there, Senator Bernie Sanders, has been an advocate for going well beyond the Affordable Care Act, and maybe even, of course, he's an advocate for Medicare for All and other types of more revolutionary measures. The American Rescue Plan Act really, in my view, builds on the Affordable Care Act, something that Nancy Pelosi has argued for. Where do you kind of find yourself in this conversation between the poles of Nancy Pelosi saying, stick with the ACA, and Bernie Sanders saying we need to go beyond it?
So I do believe we should go beyond it. I think we should ultimately get to a Medicare for All type system. But the question is how? What's the fastest path to actually getting there, given the politics in the Senate and the rules of the Senate? And I think right now we need to be focused on, number one, creating a public option, a Medicare type option within the Affordable Care Act. I think we need to be extending the increased premium support, the tax credit support that is included in the American Rescue Plan, and extending that out permanently, as President Biden has proposed. So that provision, just to remind everybody, for the next 2 years, 2021 and 2022, we lifted the cap on eligibility for premium tax credits. The cap had been at 400% of the federal poverty line. we lifted that and we said that no family should be spending over, I think it's 8.5% of their income on the cost of healthcare coverage. That is a 2-year provision as part of the American Rescue Plan. President Biden's American Families Plan proposes to extend that permanently, that additional relief. So, DJ, I think we should do that for sure. We should also be providing coverage for people in the states that have not opted in to the expanded Medicaid program under ACA. But I also support other measures, including allowing people to buy into Medicare at age 50. And all of this is part of a progression toward absolutely universal Medicare type all approach. The question is, how can we most quickly and effectively get there?
On that painful question that you have to live with every day on how, give us a little bit of a sense of what is possible. Budget reconciliation requires for viewers only a 50% plus one majority. It goes around the filibuster. I understand some people believe that, I think Senator Wyden believes, who chairs the Finance Committee, that reducing the age of Medicare can be done through, may well be able to be done through budget reconciliation, but that a public option probably cannot. What is your sense of how those chips might fall in terms of the public option versus lowering the Medicare age, and what can be done via reconciliation versus what has to be done through normal rules?
Well, this is a great question. It's as if you sort of dove right into some of the discussions we're having in the Senate Democratic caucus. Again, as the president has said, the preferred approach, of course, would be to have our Republican colleagues joining us in some of these efforts. But we also heard Senator McConnell, say the other day that he's 100% focused on blocking the Biden agenda. Those are his words, not mine. So I think one of the lessons learned from back in the 2007, 2008 period is, yes, reach out and try and enlist our Republican Senate colleagues in some of these efforts, but you can't wait for the slowest senator. And the more important thing is to get things done. And of course, the American Rescue Plan would not be law today. We'd still be waiting if we didn't use reconciliation. So on these issues, DJ, I do think we are going to have to deploy and should deploy the reconciliation process. And you're exactly right. The weeds are, it's called the Byrd rule, BYRD, after former Senator Byrd. And it's a mechanism that allows the Senate to pass budget-related measures through a process that allows you to get to a final vote with 51 votes and avoid the filibuster on other kinds of policy matters. The key is that what you do has to be tied to the budget. And so when you just think about roughly how this works, and the parliamentarian is now sort of the, she's the queen of the hill, and she gets ultimate decision-making here on this, although she can be overruled. But as a general matter, if we want to do things like extend the increased premium tax credits, that's kind of a pure budget extension of an existing policy framework. I also agree that changing the Medicare age and allowing that buy-in, as you said, Senator Wyden has indicated, I think that could be done through the budget reconciliation process. The public option, we're trying to look for creative ways that could be fit into a reconciliation process, but that could be more difficult because laying out a public option also requires a lot of policy pieces that may be seen by the parliamentarian to be, not closely connected enough to just a budget matter. So these are exactly the kind of questions that we're exploring as we move forward. And I do hope that we will move quickly. And of course, that does require getting every one of our 50 Democratic senators if we're not going to get any Republican Senate support.
Give us a sense, and I apologize for getting into Senate weeds. It's like I say, for a political geek like me, it's super interesting. And uh, Senator Merkley Jeff Merkley from Oregon has been, I think, very smart and savvy about framing the filibuster as a tool that only applies to Republican or only applies to Democratic priorities, policy, healthcare extension, health, those types of policy questions. The filibuster applies, but for judges or for tax cuts, Republican priorities, the filibuster does not apply. So he advocates for removing the filibuster. You've been an advocate for reforming the filibuster. Tell us how that conversation is moving along, if at all, given that some senators are unwilling to discuss that.
So, DJ, I'm in favor of eliminating the filibuster. I think it's an archaic rule. I think it's an undemocratic rule. And I say that with a little d, not a capital D. It takes an institution in the United States Senate, which is already anti-democratic, small d, by design, meaning that, the state of Wyoming, that has fewer people than the District of Columbia, has 2 senators, just like the state of California. And so the Senate is already weighted against the majority of the population. And the filibuster just layers on top of that another anti-democratic sort of bent. So I'm in favor of getting rid of the filibuster. If all my colleagues don't want to go as far as elimination, I would support reforming it, because there's so much that we should be doing as a country, and I do believe that the gridlock in the country is doing a lot of damage. And again, we only were able to pass the American Rescue Plan and avoid that gridlock because we used reconciliation, because we used a process to avoid the filibuster. And it's artificial to have a rule that says, okay, well, for budget related issues, you can have a workaround, but when it comes to other things like the For the People Act or protecting and strengthening our democracy, well, for those things, you can have a filibuster to block them. That's an artificial, barrier to getting things done. Now, look, there are risks to getting rid of the filibuster, but my view is the greater risk at this point is inability to move forward on some of these big issues.
One of the topics that we'll talk about later today is health equity in Maryland. In particular, you chair the Foreign Relations Subcommittee on Africa and Global Health Policy. Give us a sense just on, on how you're thinking about questions related to equity in vaccine distribution or health equity at large across the globe, across developed and undeveloped countries.
Sure. Well, let me first say here at home, we need to make sure we get this right too, which is why I was pleased that the Biden administration began shipping vaccines directly from the federal government to community health centers around Maryland and other community health centers around the country, because there were too many bottlenecks and the vaccines were not being deployed fast enough or fairly enough. And we've been working overtime to try to address that issue. Now, around the world, we've seen, the COVID-19 accelerating at a rapid rate. I think people have seen what's happening in India, it's happening in Nepal, other countries in that region. We do worry a lot about explosion of the pandemic in Africa. And look, my view is the United States, now that we've secured enough vaccine to make sure our population is entirely taken care of, it's really important that we do help others around the world. And it's a matter of doing the right thing to help, our fellow citizens around the world. It's also very much in our healthcare interests, because if this pandemic continues to mutate and you have new variants, it's very possible that it could mutate in a way that renders the vaccines that we're currently using ineffective. So far, the good news is they've held up against various variants. But again, as this moves around the world, it could get to a point where you have a different variant that is essentially immune to our vaccines. So for both self-interested reasons as well as doing the right thing, we need to be doing everything we can to deploy this extra vaccine. Now, you probably heard there are about 6, and we just had a hearing on this in the Senate Foreign Relations Committee yesterday. And we heard from 2 of the folks from the Biden administration who are the point people on the global response. So we do need to be helping with PPE and ventilators, but the big issue is identifying excess vaccine that we can deploy. Now, we have the 60 million doses of AstraZeneca vaccine. Some of that has already been promised to Mexico and Canada. Other parts of it will go to India. But the real question is, beyond that AstraZeneca vaccine supply, what more will be coming online and when? That's one issue. Number 2, the United States has provided $4 billion to COVAX, which is the international organization that's dealing with this. And we are the leading contributor, and we want to leverage others. And those funds will help encourage the development of more vaccines. But this brings me to my last point, DJ. We need to take advantage of the ability in some other countries, not all have the infrastructure, but the ability of some other countries to develop the vaccines when provided with the ingredients. But we have a shortage right now in the ingredients. And I do think that we should be deploying what's called the Defense Production Act here at home to increase the supply of those ingredients so that we can, provide them to those who can develop and produce them around the world. So we got a lot to do, and we do need to be moving faster than right now on the global side of things.
We have a question here from Riley Anderson, who asks about the American Jobs Plan, which you've referenced. Specifically, you said it should be a 21st century jobs plan, which I think is smart. Riley asks about whether there will be investments into the public health infrastructure in the jobs plan. Give us a sense of any investments that might go towards public health in the jobs plan.
Yes, a major part of the president's proposed jobs plan is to build out the infrastructure for long-term health care and to provide for in-home health care for seniors or individuals with disabilities, so that we're not relying so much on just long care facilities like nursing homes, that we need to beef up that infrastructure. We need to beef up that workforce. We have an aging population, and President Biden has really committed $400 billion of the overall American Jobs Plan for that purpose, long-term healthcare. In the American Families Plan, he has also proposed the changes that I mentioned in terms of making permanent the increases in premium in tax credit support for premiums within the Affordable Care Act. And he's also identified some of the issues we talked about earlier, public option and buying into Medicare at an earlier age. Also, importantly, an issue that I spent a lot of time on, reducing the cost of prescription drugs by giving the Medicare program the power to negotiate prices, but also another bill that I introduced called the We Paid Act, which essentially recognizes the fact that American taxpayers have spent over $40 billion a year investing in medical research at places like NIH, which is a really important investment. But oftentimes, pharmaceutical companies benefit from that research. And again, that's not a problem, but it is a problem when they then turn around and engage in price gouging and charging American patients and consumers, a whole lot more than they charge for the same drug overseas, even though it was made here in the United States and was made possible because of that American taxpayer money in medical research. So these are all things front and center on the agenda. It does all go back, DJ, to the earlier conversation. And while process may be in the weeds, this is a example where process is directly related to substance, because if you don't have the votes to get this done, obviously it's all talk. And so that this is why the question of what can be done through reconciliation becomes so important in this area.
I know your staff asked that we get you done at 1:15, so I want to be respectful of your time. Let me just ask if there's anything else that you'd like to say that I haven't already asked about to our audience of senior healthcare leaders and health policy advocates. Anything you'd like to leave them with? Maybe counsel on how to navigate the rest of 2021?
Well, first of all, I want to thank everybody who's tuning in, for being such an important part of our national healthcare debate and what you're doing in places like Maryland and other states around the country. And the states play a very important role here. For example, in Maryland, it was the Maryland legislature that really pushed back against the Trump administration's efforts to try to, dismantle the Affordable Care Act. And the state of Maryland, because it has its own exchange, was able to, create more open seasons and enrollment opportunities during the pandemic emergency. They were able to avoid some of the other changes that the previous administration tried to make. So I do want to thank everybody who's been part of that. And again, the Affordable Care Act, just a little history here, which the Affordable Care Act was passed on a reconciliation. The Affordable Care Act would not have passed at the end of the day if it was subject to a filibuster. And there's some things that I think a lot of us would have liked to do in the Affordable Care Act that were not included because ultimately it had to go through reconciliation. But the bottom line is, in this great democracy of ours, you do need to get the votes. And I do think that artificial rules in the Senate that prevent the majority from doing the will of the American people are going to hinder our progress in these important areas if we don't make some changes. So again, getting back to your first question on where do we see healthcare going, because of people on this call, we've been working constantly to expand access to that quality, affordable care, and there are measures that we need to be taking right now as we work toward making it 100% universal. So thank everybody for being part of this important democratic process.
Senator Chris Van Hollen, I appreciate your time, sir, and you're doing good work. Keep at it.
Thanks so much. Good to be with you.